Obviously, if you deal with the breadth of issues that face this government, that face all of us, if you are to achieve the impressive set of accomplishments that have been set forth on this report, you need partners. You need people who have had tremendous accomplishments in elected office, in the private sector, in public service. And the president, I think, is really just privileged to be joined by a set of advisors and leaders of really important agencies that I don't think get nearly enough attention, not only in our public discourse, but particularly within the African American community. These are leaders that are working every single day on behalf of the people that you represent. They are experts on the issues that we together focus on. So I'd like each one of them to offer a brief opening statement, tell us a little bit about their work, their priorities, and then we'd like to open it up to a question and answer session. I want you to know that this group has been very well behaved for the first panel. No speeches, only questions. And so we're looking forward to a robust discussion. We'd love to start with our HHS Secretary, Kathleen Sebelius.
Well, thank you. And thank you all for being here today. I'm delighted to be joined by some colleagues who not only are sharing the panel today, but who we work with really on a regular basis, because one of the things that the president has made clear to all of us is that, particularly in tough budget times, leveraging our assets, finding ways that we approach challenges together really maximizes our efforts and maximizes our opportunities. So it's great to have a chance to be with them. I just want to make a few comments about health and what has gone on in the last 2.5 years, because it has been a very robust and engaged agenda. The president really said from the outset, you can't fix the economy unless you fix health care. And I think that he believes that strongly. I believe it strongly, that we will not be able to have a prosperous America without a healthy America. We won't have kids who can learn in school. We won't have workers who can stay on the job. We won't have an opportunity to outcompete our global competitors without everybody being fully able to participate. And that means that they've got to be well educated, and that means that they have to be healthy. So having a robust health agenda is important, and also addressing what have been glaring health disparities is another piece of that puzzle, because we have in America, as most of you know, the best health care in the world and some of the worst health care in the world, and there are big gaps depending on your skin color, depending on your economic status, depending on where you live and how you access the healthcare system. You can either get the best care in the world or some of actually the worst care in the world because you fall through the cracks. And those gaps have been glaring and, again, put on our agenda to address. So you all know the statistics better than I do, but clearly health is one of the great areas of disparity for African Americans, for Latinos, and for our American Indian population. The prevalence of chronic disease, prevalence of cancer, low birth weight babies, infant mortality, life expectancy. I mean, pick a number, and there is a very significant gap. Also, it correlates pretty well to who's insured and who's not insured. 20% of African Americans are without insurance, and that's a significantly higher number than in the white community. A significant similarity with Latinos. So part of the strategy is working to fill those gaps, and then the passage of the Affordable Care Act. So the president signed into law. The CHIP legislation is one of the first pieces of legislation which expanded the reach to children, and more importantly than just expanded eligibility, for the first time, Congress, and I see some of the champions here today, put some money into outreach, because states who have had low enrollment, making more children eligible didn't necessarily mean that they got enrolled, because there often were barriers in place. So there was some significant outreach money that was put into community groups, into faith-based groups, programs in schools to connect kids to the insurance that they were eligible for. And so even in kind of the bad budget times, 2.5 more children are enrolled now in health insurance than were at the beginning of this administration, and that's very good news. And we are continuing that effort. We put about $100 billion, thanks to Congress, into Medicaid during that tough time, so people didn't lose the insurance that they had, and additional resources into child care and early Head Start programs that, again, not only are critical in terms of safe and secure places for kids to be, but often connect kids then to other services that they need. The Affordable Care Act is, I would say, the most significant piece of legislation, certainly since Medicaid and Medicare were passed 46 years ago, but it may be the most significant piece of health legislation ever passed in this country, because for the first time, we really will have an opportunity to finally say in this country, every American has access to affordable health care. And that's been long overdue. So it does a couple of things on the eligibility side. It raises, across the country, eligibility for Medicaid to a standard level. Right now, that's very erratic depending on where you live in the country. You may or may not be eligible at all for Medicaid. 133% of poverty and below, every citizen in this country will be eligible for Medicaid starting in 2014. A huge step forward, particularly for a lot of folks who really fell through the cracks before. And folks, yes, a big deal. Step 2 is families up to 400% of poverty will be eligible for a tax credit to purchase affordable coverage in a new marketplace, the exchanges. And if a state doesn't want to set up an exchange, and it might come as no surprise to some of you that there are some fairly hostile governors out there who don't want to do that. The good news is I get to set up the exchange. There will be an exchange in every state in the country. And we will make very sure that people know about it well in advance and are qualified and eligible. In addition, huge effort on preventive care, which has been long overlooked. We've had a pretty good sick care system in the country, but not a very good health care system. Not enough checkups, not enough screening. So whether you're in Medicare or Medicaid or in the private market, you now have a full range of preventive care, checkup without copays, without coinsurance, without financial barriers, and the community health center footprint is being doubled. Those are primary care facilities in the most underserved areas, new money for training healthcare providers, and particularly new outreach money for minority providers, nurses, doctors, nurse practitioners, mental health professionals, because it's really important to have folks who are culturally competent, serve in underserved areas, and reach out to communities that they serve. So there is a lot going on. I know that there's a lot of concern about whether this law will stand, and I think there are two very important things. One, the Supreme Court may decide later this week whether they're going to take the case. I think they will take the case. We have just had our 3rd out of 4 favorable court decisions at the circuit court level, very strong decision from 2 conservative judges here in D.C. In the majority. The 3rd judge who didn't oppose the constitutionality, he just said it isn't ripe for action yet. So again, strong decisions going into the Supreme Court. And I think there's no question that this president is committed to making sure this happens. So there's his reelection and commitment to make sure that that continues and that we have fully implemented this law by 2014 is a big piece of the puzzle. But it's probably the biggest step toward closing the health disparities that has ever been taken, and it's something that we're taking a lot of time and energy to look at. So with that, I'll stop and pass it on to my great colleague and friend. Tom and I were governors together. He was in Iowa and I was in Kansas, so we worked together in that capacity and did a lot of joint projects, and it's great to have him here as a colleague and wonderful friend and collaborator on the cabinet. Tom Vilsack.
Thank you. Michael, can I stand up there?
Yes, you can.
Okay, and can you help me?
Yes, I can. Now, will I?
Well, and if you won't, then Dr. Leonard will help. Can you help? This is a map of, obviously, of the United
Joe,
States.
come on up here and grab the other end of this.
And what this is a map of all of the school districts in the United States. And it by color-coded the school districts that basically are percentages of free and reduced lunch. Green is good. The lighter colors and the red and orange reflect significant percentages of youngsters who are free and reduced lunch. It is a startling map, in my estimation. If you draw a line, the Mason-Dixon line, you can see that we are faced with some serious issues. And this administration has begun the process of trying to address this rather enormous challenge which impacts and affects a lot of African American families and a lot of minority families. First of all, let me tell you, guys, that's
You did a
good.
good job,
Yeah,
right?
thank you. Very nice.
You know, I got to give credit.
Our administration is, and the USDA is responsible for rural housing. So you need to know that 22% of our entire housing portfolio is dedicated to minority borrowers. And in the first 2 years of this administration, over $2.3 billion was provided to African American homeowners to purchase a home in many of those rural communities. In fact, 83,000 of our loans are to African Americans for home ownership. This administration passed significant legislation as it relates to the school lunch program, and it was designed to provide greater access to that program for children. It created new mechanisms to make it easier for youngsters to qualify. I see Mayor Nutter here, who is very familiar with the Philadelphia experiment. That experiment essentially says if you have a very high level of free and reduced lunch kids, you don't need all of those kids to go through the application process in order to qualify. It really saves money, and it ensures that youngsters get that program that's so vital to their nutrition during the school year. So we're expanding that program. We're looking at additional ways to make it easier for minority and for low-income families to be able to qualify for that program if they meet the income levels. So that should expand access to hopefully thousands of youngsters to make sure that they get good meals. This administration has a record number of folks participating in the SNAP program. That's the Supplemental Nutrition Assistance Program. Now, some people will say it's because of the difficult economy. That's part of the reason. But the principal reason that we have a record number of folks enrolled is that we have called out governors in states that were not doing a good enough job of getting information out to people about these programs. We've gone down to Mississippi, we've gone down to Louisiana, we've gone down to Texas, we've gone to California, and we've essentially said when only 40% of the eligible people are actually participating in the program, the states have to do a much better job of getting information out about the programs, and we're going to provide help and assistance. And so we've seen rather dramatic increases, literally hundreds of thousands of new people involved in that program in each of those states because of the outreach of this administration. Obviously, we're the Secretary of Agriculture, so you would expect us to be engaged and involved in providing loans to farmers, and indeed, roughly 50% of our loans go to beginning farmers and socially disadvantaged farmers. Specifically, 17,300 of our loans last year went to minority producers. We were engaged in negotiations and finally resolved the African American black farmer lawsuit against the department. The President took leadership, encouraged Congress to appropriate over $1 billion to finally resolve those claims. Just last week, the court basically approved that settlement, so we'll be going through the process, and hopefully over the course of the next 6 to 8 months, we'll begin the process of finalizing that. The last thing I want to mention, in addition to the fact that we are heavily supporting and will continue to support the 1890 universities with $150 million in funding, would point out that we have what are called 2501 grants. These are grants to community building organizations, to universities, to promote better outreach into minority communities about USDA programs. We'll have about $19 million of grants available, and so folks ought to be taking a look at our website to make sure that they are applying for those grants if that's of interest. The one thing I'd like to visit with you about is a thing we call the USDA Strike Force Initiative. What we realized was that in those counties and in those states where you saw high poverty, that we were not doing a good enough job of getting information down to the grassroots. That there was a disconnect between USDA and the folks who needed help. So we selected 3 states to begin this process: Georgia, Mississippi, and Arkansas. And we basically selected roughly 125 counties in those 3 states, counties that have been persistently poor. Working with community building organizations, we've gone down into those 125 counties to ensure that there was greater outreach and greater participation by folks in those counties who are, by virtue of the nature of those counties, unfortunately heavily minority populated, to make sure that we got resources across the board: business and industry loans, small business development efforts, housing, conservation resources, loans for farmers and producers in that area. This is a report that's being issued today, today, that'll be on our website. It documents individual stories of farmers, minority farmers and producers and business owners who have received help as a result of the Strike Force Initiative. As a result of the success of this initiative, we're going to continue to expand it until we get to as many of these states that have persistently poor areas as possible. 90% of the persistently poor counties in this country are located in rural America. And so it's vitally important for us to have a much better direction and focus on our programs in those areas. So I'm proud of the work that we've done on Strike Force. We need to obviously expand it and continue to promote it. We've also begun a massive effort within USDA at what we refer to as cultural transformation. Unlike HHS or HUD or some of the other agencies represented here today, obviously USDA has had a sordid history. And we wanted to make sure that the future for USDA was far more positive than its past in terms of its relationships with minority populations. So we've begun a massive effort of cultural transformation in which we're trying to modernize our workforce, making sure that it reflects the diversity of America, make sure that it is culturally sensitive, and make sure that we do a better job of connecting and creating relationships between minority populations and USDA programs. We've done a massive review of all of our programs in a 14-state area that gave rise to most of our claims. We had over 200 recommendations on how we could improve those programs. We have a monitoring system as part of cultural transformation to ensure that we are improving our outreach and improving our impact on people that we care about. I'm proud to say that last year we had the lowest number of claims involving FSA, Farm Service Agency, involving minorities since we began keeping track of these numbers. We also had the lowest EEO complaints since we began keeping track. Joe Leonard can attest to this. Among the federal agencies, we had the lowest percentage as a percentage of our workforce of claims, but the highest number of findings of discrimination because we take this very seriously. There is a zero tolerance policy at USDA which we are trying to ensure is carried out. So this has been a concerted effort on the part of the President through his USDA to reach people and to get the resources to people who need them: housing, food, jobs, credit. an opportunity for us to change the history of USDA and to settle past wrongs. So I'm proud of the effort that our team has put underway. I look forward to your questions, and I'll turn it over to the folks from HUD. Thank you.
We're going to move quickly, thank you, Secretary Vilsack, to Estelle Richmond, who is going to speak and then leave to go accept an award on behalf of the employees of HUD from the President of the United States.
Yes, sir.
All right.
I do apologize for having to leave early, but an employee of HUD is one of 4 individuals that's going to be recognized by the President for coming up with a suggestion that will save the federal government $30 million a year. So we want to make sure we acknowledge that as a great opportunity. Let me begin by saying this has been a hard time for all Americans. It's been particularly hard for low-income families and communities of color, rolling back about 15 years of gain in some urban cores. And when President Obama took office, the median income had dropped by $3,800 in the past decade. At the same time, the share of income going to the top 10% has increased by a third. And certainly at HUD, we could feel that difference as you look at the housing market over the past 3 years. As the President has said, we need all hands on deck to grow our economy and win the future. And we can't do that when a third of Hispanic, African American, American Indian, and Alaskan Native children live in poverty. More than 10 million Americans live in neighborhoods of highly concentrated poverty, with poverty levels of 40% or higher, costing 4% of our GDP every year. Over the last 30 months, HUD has been at the forefront of efforts to extend a lifeline to our most vulnerable families, while keeping middle-class families from losing any more ground. One of the things, and I'm going to go through them fairly quickly, one of the things that the Recovery Act helped us do was save folks from homelessness. 1 million people. 3/4 were families with children. We've also worked with our partners in the Department of Energy to modernize more than 500,000 public housing units and provide green retrofits to over 750,000 properties by reducing energy costs for families. And all of you know that energy costs have only been going up in the past several years, adding a great deal of burden to our families. We've also been able to provide permanent housing to more than 99% of the 40,000 Gulf Coast families who were about to lose their temporary housing assistance when President Obama took office. In addition, we've investigated more than 10,000 complaints of discrimination this past year and took action against more than 1,600 predatory lenders to shut down their ability to do business with FHA. And we've been able to do mortgage modifications for about 5.3 million modifications for families. Since President Obama has taken office, our housing counselors have helped nearly 6 million families. And FHA has kept the dream of home ownership alive for millions of families during this crisis. In fact, 6 out of every 10 minority families have bought homes with FHA assistance last year. But that's not enough, and certainly it's not enough if you are part of the group still struggling with poverty, homelessness, discrimination, and unemployment. So a pathway to this opportunity becomes critical. So we've begun to lay the foundation for longer-term reforms that will grow the middle class and allow families to climb the ladder of opportunity. And we all know the importance of education, but education alone doesn't address the root of poverty. Research has shown us that one of the most important factors in determining whether or not children will do better financially than their parents is their zip code. And you could see that very dramatically in the chart. And that is why HUD is very focused on our Choice Neighborhood Grants. These Choice Neighborhood Grants build on the success of our Hope 6 program to transform distressed neighborhoods into healthy mixed-income communities. We've also aligned our choice neighborhoods with the Department of Education's Promise Neighborhood initiatives, which is modeled on the Harlem Children's Zone. It is also why we've also launched a rental assistance demonstration project to bring private capital to over $250,000 publicly owned homes. And that's based on a very simple idea, that we can't build good neighborhoods if we're walling off our poorest families from the neighborhoods and opportunities that surround them. So when we just put them in a place and then build around them and not include them, we're not really relieving them of that poverty. As you probably know, HUD we put our money in regions. We put our money in cities and counties. Our focus is to try to get the money as close to the people as we possibly can. So the construction jobs, the development jobs, impacting the real estate jobs, all become a reality. And we do this as much as we can with our regional, county, and city partners, so that we really can see the impact, and you can see that impact as quickly as possible. One of the things that we're a partner with all of my folks here today is Strong Cities, Strong Communities, which begins to look at how do we help local communities and local cities develop that capacity so they will have the tools to continue in the future. The pilot initiative is focused on 6 distressed cities and regions and providing intensive on-the-ground technical assistance. The goal is to provide cities with long-term challenges, a plan for the future, to have institutional capacity to realize that vision for all the families in their community. But our future lies ahead, and one of our current ongoing partners has been that in transportation. The goal is to invest $50 million in transportation because transit to work with better highways and roads really helps put people back to work. As you know, a critical part of the American Jobs Act is Project Rebuild. Project Rebuild will create 200,000 jobs in communities across the country. And we are working with the Department of Transportation because transportation and housing represent more than 50% of a family's income. And it's only when the two of us can work together to resolve some of those problems that we can actually make a difference. In fact, Secretary Donovan today is in Arizona talking about Project Rebuild, and he's been visiting many parts of the country to make sure people are going to be familiar and supportive with the impact that Project Rebuild will make. And this will help all of our hard-hit industries as we help keep builders keep construction workers on the job and give real estate agents the opportunity to show and sell homes once again.
Secretary Richmond, I'm going to interrupt you by telling you that in order for me to do what I need to do and keep my job, which I love, you need to get out of here. Head across the street. Thank you so much, and congratulations once again.
See this as we're saving $30 million.
$30 million is real money. Thank you so much.
Thank you.
Good to see you again. We've been joined by one of our leaders here at the White House, the head of the President's Council on Domestic Policy, Melody Barnes. Thank you, Melody. Melody has a fan club that she brings with her everywhere, and so they're here with us today. Administrator Jackson, can you please provide us with some opening comments?
How long do I have, Mike?
I'll let you, to be determined. Just a few minutes.
I don't want that hook. Well, first, thank you. And Michael has been wonderful, and Melody, it's good to see you. You've been so busy, I haven't even seen you lately. And to join my cabinet colleagues here. I will try to be very, very brief because I want to leave some time for interaction. I was sitting here thinking as my colleagues were speaking about that old saying we've all heard, it's not just the things you don't know that get you into trouble, it's the things you know for certain that just aren't so. You know, there's some things you might not know that I'd like to talk to you about when it comes to our health and our environment. Kathleen and I, Secretary Sebelius and I did a joint op-ed not long ago in USA Today about health disparities and the environment and how the environment is disproportionately still today affecting the health of communities, poor communities, and too often because of the vestiges of racism, communities of color in our country. But it's also some of the things you might think are happening that you need to realize aren't happening and why they're not happening. And that's where I want to spend my time today. I am the first African American to head the Environmental Protection Agency. That's because of President Obama. I'm really proud when I sit and look at this room of leaders, so many, and you know, they like to say that we don't care about the environment, but I grew up, as all of you did, knowing and hearing these truths. The right to clean air and clean water is a very American right. The right to have a safe and healthy place for our families, our children to go to school, to worship, to play, to work, is very, very American. And yet the environmental movement, in the face of the movement, for a long time had been seen one of privilege, of being white. And it is anything but. My father died of a heart attack when he was 49 years old. My brother has asthma. My son has asthma. Most of my husband's family do. I would bet, and don't want to ask you to do it, that each one of you can say exactly similar stories, not exactly the same thing. Someone who went too soon from heart disease. Did you know that one of the leading causes of premature death through heart attack in this country is soot in the air? We can correlate those deaths and admissions to emergency rooms with the quality of the air on any given day. Or how about asthma, which is still somewhere around 6–7% amongst children in this country? It's much higher in the African American population and in the Latino population. In fact, Puerto Ricans have even the highest rates in the country as an ethnic class. And yet, did you know, and I think most of us do know this, that the amount of smog on a hot summer day directly correlates to asthma attacks, to emergency room admissions. Heart disease, cancer, and respiratory disease are 3 of the top 4 deadliest health threats in this country. And I'm very proud to work for an administration that is trying to address that through Kathleen's efforts, through the President's efforts on the Affordable Care Act. But they all 3 have an overwhelming impact on our communities as well. So I grew up in an age believing that it was in the interest of our people to attack clean air, and dirty water, and to ensure that we have money and funded programs for brownfields. So many of you I know through the brownfields context, the idea that putting $1 of public money into a community leverages about $19 to $20 of private sector investment, because you're saying you believe and you want to help clean up a piece of property. The investment, the business, the small business, the economic opportunities, and the jobs follow. That's the reason I wanted to have the honor of running the Environmental Protection Agency for this president at this time. I'm proud to be part of an administration and an EPA that has taken long overdue steps to address our clean air challenges in this country, and yes, we still have them. We have a rule coming out next month. It's to deal with mercury, arsenic, lead, and acid gases from power plants. And that single rule alone will save hundreds of thousands of lives a year, will prevent hundreds of thousands of asthma attacks a year. That's not all we've done. We've instituted a partnership around urban waters, because waterways in our communities have historically been the lifeblood, but for too long, I grew up in New Orleans, Louisiana. It wasn't until Mayor Moon Landrieu, when I was maybe 10 or 12, who decided to open up a river walk, that I really saw the Mississippi River, because most of it was industrial. It was given over to commerce, and that extraordinary opportunity was lost to the community to make the most of its riverfront. I do want to say that there are mayors in this room, Mayor Nutter, congratulations, but again, who have embraced, even educated our community about the importance of our waterways, our urban waterways, about sustainability and the jobs that can be created when we invest in those communities. I just want to make one other thing, the things you don't know that can really hurt you. There have been 170 votes in this Congress alone to overturn the Clean Air Act and the Clean Water Act and the brownfields rules and the waste disposal rules. And so you might think that that's some abstract thing. But if you believe, as I absolutely do, that pollution disproportionately harms people of color because of where we live and where these facilities are located, then efforts to overturn our attempts to get cleaner air and clean water will disproportionately hurt us as well. And what is lost in that debate is the job creation opportunities in investing in cleaner energy sources, cleaner water, brownfields cleanup that come from putting investments in those kinds of infrastructure in our communities. They level the playing field, they make it okay for us to compete, they make it easier for mayors who are trying desperately to lead their communities back to prosperity. A strategy to grow our economy has to be built on the idea that we're not going to sacrifice clean air and clean water, not just because we want a beautiful place to live, but because we can't ask our children to settle and live in a community that gives them two strikes towards heart disease or cancer or asthma or other illnesses. I just want to say that none of that would be possible without the strong support of this president and his White House. We are going to fight those battles each and every day. They'll probably be vote number 171 and 2 tomorrow. But I just want you to know that we're going to continue to stay here and be the different face on these issues of public health, and working with our partners to do it. So thanks very much.
Thank you.
Maybe too busy repealing health care.
Yes, sure.
We have been joined by Melody Barnes. Melody, can you offer us some opening remarks?
Sure. Well, first of all, thank you all so much for being here. It is wonderful to be with you this morning. Some of you I have just seen as recently as last week. Mayor Nutter, we were in Philadelphia on a panel together, and Congresswoman Edwards about 2 weeks ago. So it's a pleasure, and also to be here with members of the President's Cabinet, who I can tell you are such extraordinary leaders, and men and women that the President counts on as we all work as a team and work very, very hard. We push each other to try and get things done, so it's a pleasure to be here. I will be very brief, again, as Administrator Jackson said, so we have a chance for engagement, but I do just want to talk for a second about an umbrella document. I know you've had the opportunity this morning to hear about specific areas that members of the President's Cabinet are working on, but I would also commend to you a report, in addition to the report that is being released today, but a report called Pathways to Opportunity that we released just a few weeks ago. And to give you some context for that, I know you all know, because of the work that you do, that the story that embraced this administration when we walked in the door in January of 2009, just how bad things were. You know, those 22 months of straight job loss, the loss of 750,000 jobs every single month for the first quarter of 2009 when we walked in the door. But that's the story that often gets told without people understanding and talking about the fact that things were bad for so many people before 2008. Before we started talking about the Great Recession. And, you know, I just picked a point in time just to illustrate that. As I often go out and talk to people, you take 2003. Unemployment was about 6%. But when you look at unemployment for African American men, it was about 11.6%, almost double that of the general population. If you also look at family income was, loss of family income was about $1,900 for people at that point in time. But for African American families, it was about $3,000 worth of income stagnation and loss if you just take that snapshot in 2003. So what we have done since we walked in the door was to focus on those problems. And we did it through the Recovery Act, we did it passing health care, we did it passing the child nutrition bill and other pieces of legislation. We did it in the ways that Administrator Jackson has been talking about, protecting the Clean Air Act, protecting the Clean Water Act, and ways that we know are efficient and effective in trying to protect and also lift up communities. But in addition to some of the traditional tools and resources that we had, we also started to build and think about innovative ways that we could approach these problems. So if you look at this report, you can find it on whitehouse.gov/opportunity. That's whitehouse.gov/opportunity. You look across a range of different areas and see what we've been able to do for the past 3 years to try and attack these problems that are preying on our community, on the African American community, on other low-income communities, and trying to address them, whether it's education, and I know Martha Cantor was here earlier today and talked about some of those initiatives, or healthcare, or agriculture, or the environment, or housing, or transportation. And one of the things that I want to point out is that we've tried to do that breaking out of silos. People don't have an education day on a Tuesday and have a transportation day on a Wednesday. Families are impacted by these issues every single day. So we've worked together, and that's why I wanted to mention at the top the tremendous asset that the members of this cabinet are, not only to this administration but to the country, because we've worked collectively and we've worked collaboratively to start thinking outside of those silos and address the problems that people face as they face them. So our Sustainable Communities program that brings together EPA, brings together HUD, brings together the Department of Transportation, so that we can think about the way that people live their lives, think about attracting jobs and businesses to communities, think about cleaning those communities up, and so that our kids can go out and play and be active and lead active lives. It was the way that I grew up. The way I'm sure many of you probably grew up when, you went outside, you played in your neighborhood, be in by the time the street lights come on. That was the way it was. I see Gary Flowers over there somewhere. We used to play kickball in his, there he is. I used to play kickball with Gary around the corner in his backyard. I mean, and that's the way we create healthy, active lives for our children, but also create commerce, create job opportunities, create better and more stable housing in our communities. You think about our work around Promise Neighborhoods, again, a place-based idea based on the work that Jeff Canada has been able to do at the Harlem Children's Zone. We use that as a model, but went out and started to attract communities to this grant program so we could think not only about education, but also think about health care, think about nutrition, think about the supports that family members, that parents need to better raise their children, but also create a more stable economic set of opportunities for their families and for their children at the same time. So not only thinking about how we support individuals, not only thinking about the bricks and mortar that make up a community, but also focused on the fact that we can turn places that have been distressed for so long into places of opportunity that attract business, that attract jobs, that attract housing, that create stability. So again, I commend this report to you and hope that it will be a guide for you as you go out and you talk in your communities about the work that we've done, and also know that it's something that we're building on. And the President has pushed all of us, and we've been in those meetings with the President where he's pushed all of us to think more boldly, more creatively. I just came from one of those meetings about the work that we're going to do to build on what we've been able to put in place over the past 3 years. So I wanted to mention that report to you and a few of the way that we've been thinking about our work, but then want to turn it back over to Mike so we have a chance for further engagement.
Thank you, Melody. Please, round of applause. Any questions, not speeches, for this amazing panel? Yes, ma'am. Do we have someone with a microphone on this side? We can hear you. Please stand up.
Diane Wallace, Booker with you at Dream Academy. I'm thrilled to hear about the increased access to the free and reduced lunch program. That is incredible, significant support for families with children in this country. Can you speak a little bit more specifically about what's being done around the quality of the food that's being delivered? Is there any efforts to really try to ensure that we can get more fresh food, fresh vegetables, locally grown food to these families?
The question is about the quality of the food, fresh food, locally grown food offered to families through the free and reduced lunch program.
Well, the First Lady has really inspired the nation to focus on more nutritious eating and more physical activity. So part of her Let's Move initiative is designed to encourage us at USDA to do a better job of advocating for nutrition. So part of the Healthy Hunger Free Kids Act, which is really an historic piece of legislation that would not have passed but for the advocacy of the President and the First Lady and members of Congress, it essentially establishes higher standards for nutrition. It says less sodium, less sugar, less fat, more fruits, more vegetables, more whole grains, more low-fat dairy. It also establishes summer feeding programs and a variety of other efforts to make sure that that nutritious eating extends throughout the entire year. We're also going to provide for better standards for what we refer to as competitive foods, which are the vending machines that kids have in schools, to make sure that the healthy snack is the proper snack and the easy choice to make. We at USDA have started, the First Lady's garden is obviously the best garden. However,
We'll tell her that you said that.
please do.
A lot of witnesses, Tom, a lot of witnesses.
We have 1,450 people's gardens, which we established at USDA facilities around the world. And in the last month, we donated 800,000 pounds of fresh produce to food banks from those gardens. And we're doing a better job through our Know Your Farmer, Know Your Food initiative to link people to what is grown and raised in their facilities. And so we have teams that go to local schools and ask, do you know what's being grown and raised in the local area, and would you be willing to work with us to contract with local farmers to purchase it? And so we're building the supply chain, cold storage, using all of our rural development tools. So there's a lot of activity in this space. If you look at our website, USDA.gov, Know Your Farmer, Know Your Food, or the Healthy Hunger Free Kids Act, you can get more information about it.
Great. I have been personally impacted, a beneficiary of the White House's emphasis on healthier living. Beneficiary, although when it first started, I probably called myself more of a victim. But it's something that permeates all of our work, and I really appreciate that question. Let's see. Who do we have? Come on now. There we go. Mayor Nutter.
Okay. Mike, thank you, and good morning, everyone. Secretary Vilsack, always good seeing you. We need to see you back in Philly soon at the Farmers Market, Reading Terminal, rather. You've done some amazing work, and we've done a lot of things, and I want to commend you for your strong stand on the school food program and expanding the Philadelphia program across the country as opposed to the previous administration's efforts to kill it. And that's been very, very helpful. I want to talk about hunger. Unfortunately, I have the second worst on a hunger index analysis. The second worst congressional district in the United States of America runs through Philadelphia. And the first is in New York, and it's by mere hundredths of a percentage point, so it's virtually no difference. My question is, how do we develop plans in our respective cities to essentially end hunger in America? No one in this country should ever be without food. And it's not, again, it's not a criticism of you and the department, but just for visual purposes, we know when things happen all around the world, the United States, of course, always steps up. And a day or so later, there are pallets with parachutes on them going all around the world. And my only question is, where is that food the day before? There's food in America somewhere that should really also be in the bellies of kids in this country, and figuring out how we get that supply chain going to all of these cities to literally end hunger in America is something I'd really like to work with you and other agencies on.
Thank you for that question, Mayor. Secretary Vilsack?
Yeah, just Mayor, I would suggest that we work together with the Share Our Strength program. It's a private sector, nonprofit effort. Jeff Bridges, a Hollywood actor, is very much involved in this issue, and he will come to your city. He will, along with Billy Shores, who's a fellow from Western Pennsylvania, Pittsburgh, on the other side of the great state of Pennsylvania, will come, and I will be happy to do it as well, to sort of focus the attention and to spotlight the need for more concerted effort on hunger. Secondly, this administration has been very supportive of trying to get surplus commodities into food banks. The Recovery Act had a substantial amount of assistance. I think you'll probably see more of that coming when we talk about the Farm Bill legislation and the need for us to get surplus commodities into communities. The third thing is the Healthy Hunger Free Kids Act, as I indicated, it not only addresses the issue of schools, the school year, but it also addresses the summer feeding program, and would certainly work with you to make sure that Philadelphia is getting its fair share of assistance in terms of summer feeding. And the last thing I would say is we need to do an even more aggressive effort in all parts of the country to make sure that folks know about the SNAP program. You know, the SNAP program, if I can just take 30 seconds, Michael.
Yes, sir.
There is a misunderstanding about this program, and it's intentional. People have decided to stigmatize those who receive the SNAP benefit. Here's what you all need to know about this. Only 8% of people receiving SNAP are on welfare. Only 8%. 92% are not. And when you talk about hunger, you're talking about families that are working families. These people are playing by the rules. They're working hard. Many of them are minorities. Some of them are senior citizens, and a lot of them are kids. And it's a sad day when governors and states fail to work to get the word out about SNAP because they think they're not interested in that program. And that's what we were combating when this administration came into play. There were 38 million people receiving SNAP when we came into office. Today it's 45 million, and I tell you folks, it is not necessarily because of the economy. It's because this president has told me to be aggressive in terms of making sure this program works for people it's intended to work for. So again, I think there's an opportunity, Mayor, for us to publicize the SNAP program and make sure that folks understand it's relatively simple to qualify for if you're struggling.
Thank you, Mr. Secretary. Right here in the second row.
State Representative Tashara Jones from St. Louis, Missouri. Secretary Sebelius, many states have been passing these healthcare compacts instead of passing the enabling legislation to do healthcare exchanges. Wanted to get your position on that, and also thank you for the listening sessions that you've been conducting nationwide. I've attended a couple of them, and they've been very helpful.
Well, by really the end of 2012, we will have to begin certifying whether or not a state meets the qualifications to have an exchange set up and running. And there are going to be a series of steps that they have to go through, but it will essentially amount to whether or not they're going to have at least two programs, two insurance products to offer with essential health benefits, have the ability to enroll citizens, because a lot of folks say, oh, we'll do the insurance piece, but we're not quite sure how we're going to enroll anyone. It will have to be seamless so that if a consumer comes through the door, computer portal, or comes to One Stop, they don't have to figure out if they qualify for Medicaid or the exchange. That should be automatically assigned. So there'll be a whole series of steps. I think that there's no question in some states the legislation has not been passed. I think there's, states are going to need enabling legislation if they're going to set up an exchange. Having some kind of written document that wanders around. I mean, no insurer prices a product on a promise that maybe we'll get together and sell what you have. There'll be a point at which they're either in or out. We are going to, at the Department of Health and Human Services, make sure that there is a robust federal framework so that the losers at the end of the day aren't the 35 million uninsured Americans who will then qualify for health care in 2014. We want to make sure that they have a door to come through. We think there'll be a bunch of states who kind of want to get there, but they may not be there quite in time. So we'll have some kind of on-ramps. But as you know, we are working kind of hand-holding in a lot of states. Each state is in a little bit different place, and we'd love to have as many states who want to operate their own exchanges, but it can't be to the disadvantage of the consumers in that state. The goal is really to get people health insurance that they, by federal law, will be eligible for. And so whether a state does it or we do it, we want to make it as easy as possible for the consumer at the front end to actually find affordable products for themselves and their families. Let me just mention one thing. If you all haven't yet visited this website, it's one that I would urge you to visit and keep visiting and share with your neighbors and friends. Healthcare.gov is a website that does a couple things that have never been done before. First of all, right now, it has an active profile of what's available in the market by product, by price, in your zip code for your health status. So we're not selling anybody anything, but we really, I would say, encouraged and coerced insurance companies to finally put their products side by side. So that's been a struggle for small business owners, for individuals to even know what's available. Because often an agent will quote what he or she is selling, but they may not have the whole snapshot of the market. So that's up and running. There's also a pretty good timeline of when it is that benefits come online, what's available now, what changed in 2010, what needs to change, so you can monitor that. And a lot of good health information. So healthcare.gov is something that has a profile of the Affordable Care Act, what's available now, the current market, and lots of information, and it gets updated on a very regular basis. So I would just urge you to kind of keep it in mind and check it out.
Can I just add one quick thing to
Yes.
that? And Secretary Sebelius has been such an extraordinary leader in driving this home. But I think, in part, going to your question, there's this, as everyone knows, this debate out there about whether health care or not. And people are not understanding fully, and we're trying to get the word out, the benefits of health care that they are already getting right now, even before the exchanges come online. And we think that conversation is important to encourage states to move forward and to set up these exchanges, because the population won't accept anything else. So understanding the fact that children are already benefiting if they have pre-existing conditions because we passed the Affordable Care Act. Understanding that seniors now are able to get their wellness visits because we passed the Affordable Care Act, that they are saving on average about $500 because we're working to close that gap that is the donut hole on prescription drugs. The list goes on and on. We've got 1 million young people who now have insurance that didn't have it a year ago because of the Affordable Care Act. So, the work that Secretary Sebelius and the President and others are doing to make sure that these benefits come online and are already available to people is important to helping people understand why we have to go the rest of the way and getting states who are sitting on the sidelines, as opposed to moving forward and making sure that those full benefits are available to people in 2014.
We need a question from a young man. Here we go. Right. Yes, sir. Yeah. Thank you. And then I'm gonna solicit a question on the environment, because Administrator Jackson's getting lonely over there.
Hi, Bill Diggs, CEO of the Chamber of Commerce in Miami. As we talk about the healthcare debate, one of the biggest issues that we're concerned about, and some of us that are in states that are not so friendly to black businesses, is that as you begin to set up these health exchanges, we're hoping that as you analyze whether or not the states are going to truly have these real impactful exchanges, that you take a look at the purchasing and the procurement opportunities as well that we consider that might be existing for black businesses. Or has there been any discussion to make sure that as you validate these exchanges in some of these Republican states, that they still make sure that they have minority and vendor and procurement policies that are relative to affirmative action and set-aside programs?
Thank you.
Well, I think it's a great question, and we are certainly trying to be very mindful at every step along the way of, the issues around not only procurement policies but outreach policies. What we know is that African American business owners often are small business owners, so have a lot to gain from a new marketplace, because right now small business owners, as you know, pay about 25% more than their big competitors to just keep health care. It's often a way to keep your best employees, because employees will leave to go follow health benefits. But we are certainly looking at every step along the way. Ironically, the mantra of somehow the fact that health care, the passage of the Affordable Care Act did a disservice to the economy, I think the jobs number disproved month in and month out. The one area that has consistently grown for the last 2 years in the overall economy are healthcare jobs. and continue to grow in a robust fashion. And it's everything from the conversion to electronic health records, which has spawned new companies, new providers, to training for new health workers in communities, to the construction jobs for community health centers, to the new products in the marketplace. So we are definitely paying attention to the set-aside and procurement laws, and we'll continue to do that, and think that's a very critical part of this puzzle.
Great. Let's go all the way in the back. We have a lady in red back there. Can we get a microphone back there to her, quickly? All the way in the back. I know you well. I know you can, but we'll offer the microphone to you.
Thank you very much. Faye Williams, National Congress of Black Women. And I'm glad you asked Mike for an environment question, but it's also related to health. I spend a lot of time on the Gulf Coast after the Gulf oil spill and the disaster that's caused. And as I travel, I hear the teary stories about asthma, especially that Administrator Jackson mentioned. I wonder if the administration is doing anything to push British Petroleum to get the Gulf Coast cleaned up and to pay Pritchard, Alabama, and other cities that have invested money in cleaning up the environment. Thank you.
I'm going to take my privilege with the microphone and interrupt, because I have Heather, who wants to join us and introduce a special guest.
So the room looks great today, and because it looks so wonderful, a very special guest has stopped by to give you all a greeting. So it's my pleasure and honor to announce the 44th President Barack Obama.
Thank you. Thank you, everybody. Thank you so much. Thank you. Thank you, everybody. Thank you. Thank you. Thank you, everybody. Everybody, please have a seat. Thank you. Thank you. Everybody, please have a seat. It is wonderful to see all of you. I got some old friends here. Not old in years, but been knowing you. It is wonderful to see all of you. I want to first of all thank Heather, who is doing outstanding work. Heather has my complete confidence. She has my ear, and so when you're talking to her, you're talking to me, which means she's going to be getting a lot of phone calls, I know. But she's up to the task, and we're very proud of her. I want to thank all of you who are here. We've got some elected officials. Mayor Nutter, congratulations. I know we had a little bit of election work going on yesterday. I was in Philly yesterday, did not say anything about football during my visit. Didn't say anything about football games. Mayor Mark Mallory is here. There he is, right there, Cincinnati. We have, I think Congressman Donna Edwards is around here. There she is, right here. And she's been a great partner. And of course, we've got leaders from all across the country. So many of you have worked so diligently during what has been one of the toughest times in our country's history in order to provide opportunity, to make sure that communities were able to hang on during difficult times and begin to rebuild again in the wake of an extraordinary financial crisis and the deepest recession we've seen since the Great Depression. Obviously, we have enormous challenges. The unemployment rate in the African American community has always historically been higher than the norm, and since the unemployment rate generally is high right now, it is way too high when it comes to the African American community. Many of the challenges that existed before the crisis have been worsened with respect to opportunities for decent housing, with respect to making sure that our schools are equipped to prepare our kids for the 21st century. So we've got a lot of work to do. But the report that has been prepared, that I know our teams are going to be talking about, that will be released, I think, is a compilation of everything we've done over the last 3 years that has not only lessened the severity of the crisis for millions of people, kept millions of folks out of poverty, made sure that millions of folks still had unemployment benefits, health care, et cetera, but also talks about the foundations that we are laying so that as the economy recovers, the African American community and communities all across the country of every stripe are going to have an opportunity to finally begin to rebuild so that we are seeing good, solid, middle-class jobs with good benefits, that families who are desperate for their piece of the American dream, that they're going to be able to achieve it. Now, some of these strategies are longer term. All the good work that we've done, for example, in education. The payoff's not going to be tomorrow. It's not going to be next year. It's going to be 5 years from now and 10 years from now as we steadily see improvement in the performance of our public schools. When it comes to health care, we are already seeing enormous improvements in terms of funding for preventive care, for community health clinics, but full implementation is going to be taking place starting in 2013. We'll have those exchanges, and suddenly families who did not have access to health care will be in a position to get it. So some of these things are going to be phased in over time and will not bear full fruit for some years to come. But as all of you know, we've got a sense of urgency right now, the fierce urgency of now, when it comes to putting people back to work. And many of you have been engaged in pushing Congress to pass the American Jobs Act. This is the only plan that out there that independent economists have said would put people to work right now. It's been estimated that it would grow the economy by as much as an additional 2% of GDP, put as many as 1.9 million people back to work, would be targeted at not only getting teachers back in the classroom and construction workers on the job rebuilding America, but also targeting the long-term unemployed, allowing communities that have seen more than their fair share of foreclosures to be able to take those properties and start rebuilding them, improving our infrastructure in vital ways that will spur on economic development, summer youth programs so that our young people can start getting on track and getting in those habits of work that are so important to instill a sense of responsibility and a payoff for behaving responsibly. All those things are contained in the American Jobs Act. Now, as you know, so far, the Senate has just said no. Not because these are ideas that are partisan. These are ideas that traditionally have been supported by Democrats and Republicans alike. Their argument for why they haven't passed them so far has been that, well, they don't like how we're paying for it because we ask, for example, folks who make more than $1 million a year to pay a little bit more in taxes in order to make sure that our economy is strong. The American people are behind us on this. Not just Democrats and independents, but Republicans support many of the ideas in this bill. And so we're going to keep on pushing very hard. And we're going to need your help to continue to mobilize communities to focus on how we can put people to work right now. In addition, though, we also want to continue to find ways where we don't have to wait for Congress. Where are initiatives that we can take right now administratively that would make a difference in the communities that all of you represent? And so part of the function of this gathering is for all of you to share your best ideas, your best practices. What are things we can get implemented in the next 3 months? Where are areas where you see a potential difference being made? I'll just give you one example. We, on our own initiative, identified the need for small businesses who, in these difficult economic times, have some cash flow problems. We said, you know what, let's speed up payments to them. They've already done the work, or they're in the process of doing the work, and the federal government likes to sit on that money until the last day. Let's see if we can send them that check a little bit sooner so that they can put that money back to work. And obviously, African American businesses typically are small businesses, so this is something that can benefit folks right away, and we can start seeing a difference in our communities. I want to make sure that those are the kinds of ideas that all of you are providing to us, sharing with our cabinet secretaries, sharing with our staffs, and what we want to do following up on the report about what we've already done is hopefully 3 months from now, 6 months from now, we'll be able to go back and say, here's some additional steps that we took based on community input. I just want to so use today as an opportunity to share ideas with us. We're going to have breakout sessions. Let's do some brainstorming. We want your input. We want your ideas. At the end of the conference, I've asked Valerie Jarrett as well as Gene Sperling, who's my Chief Economic Coordinator, the head of the National Economic Council, to come back and hear what ideas were proposed. But the last point I want to make is this, and I made this point just recently when we were dedicating the new King Memorial. We have been through tougher times before. Our parents have been through tougher times. Our grandparents have been through tougher times. We know tough times. And what we also know, though, is that if we are persistent, if we are unified, and we remain hopeful, then we'll get through these tough times and better days lie ahead. So I just want everybody to participate here in a spirit of persistence, determination, and unity. And if you maintain that spirit, then I'm confident that not only will the African American community emerge from these difficult economic times stronger than we were before, but this entire nation is going to come out more unified, better equipped to deal with the challenges of the 21st century than we were before. So I appreciate all of you. God bless you. God bless America. Thank you. Thank you.
So I don't know how I'm going to follow that. I do think it's time for lunch, but this discussion is about some important issues. We'll let the members of the press file out. They got to catch up, with him. He walks, he keeps in shape, so he walks fast. Thank you, sir. But I do think I'm stalling again for time here. And no, I'm not going to tell any jokes. I do think we want to answer that last question because it was important. And this is a discussion about substantive policy issues. And so, Administrator Jackson, if you could address that, I'd appreciate it.
Back to the Gulf of Mexico, because they're very important. But thank you for the question. I don't know if all of you remember, during the Gulf spill, the president did an extraordinary thing. From the Oval Office, he addressed the nation, and he said, we're going to deal with this gushing oil well, we're going to deal with the cleanup, the immediate cleanup, and then we're going to put together an effort in my government to make the Gulf stronger than it was before the spill. I'm the chair of that effort. It's called the Gulf Coast Ecosystem Restoration Task Force, long name. We wish we had a shorter one. But we just put our draft report out, and our final report will be due out in early December. It's a report to the president, and he charged us with focusing on the ecosystem because it is troubled. Everything from the seafood industry to the health of the waters in the Gulf to the communities. There's an entire section of the report titled Resilient Communities. And in fact, You asked about local governments. We impaneled a local government advisory group, and Pritchard, Alabama is well represented through the mayor, who sits and chairs, as I recall, that group. So the president ordered us to put the report to him with recommendations from the Gulf for how to make that community stronger and more resilient. And it deals with everything from flood control, with the loss of wetlands. As you heard, I'm from New Orleans, and we all know now that the loss of wetlands south of the city meant that there was no break to that hurricane when Katrina hit, when Rita, Gustav, Ivan, all those hurricanes hit wetlands and barrier islands, slow them down, as well as the ongoing work through compensation on the economic side. And I have to thank my cabinet colleagues, actually both USDA, through the National Resource Conservation Service, but certainly HHS, who joined us at every single meeting to deal with everything from mental health to long-term health concerns and ongoing investigations with respect to the ecosystem. So that report will be due to the president in December. And as with everything else, as Melody explained, we expect another year of work to implement its recommendations. And none of that would have happened without this president being clear that this was not a one summer event, but an opportunity to bring some long overdue attention to the Gulf Coast communities and states who love it so much. So thank you.
Great. Well, listen, I just want to offer a thought that, you know, we just heard from the president. You know, he gave us our charge. And when we talk about, and when he speaks of, which is something that he's given to all of us who spend time with him, this sense of the fierce urgency of now, I want to just make sure that you all understand that we do this in the right spirit, with the right things in front of mind. And so I do want to take a moment. We have a lot of leaders in the room. And a lot of important people who, and so I'm loath, I hate to pick out one, but we do have Martin King III with us today. A leader, a partner, and a friend. And so as we think about his legacy, the work of the King Center, the legacy of his parents, and all that we do, I hope we can move to our next session with that in mind, lifted up and focused with our eyes on the prize, but also with a sense of determination and unity to bring real solutions, as the president has asked for, things that the executive branch can do right now, things that the folks outside of government and nonprofit, in our churches and our synagogues and our mosques, those who are in business, those who are in foundations can do right now to address some of the issues that we had an opportunity to discuss. So with that, I want to thank our panel. And I want to invite you all to join us for lunch. We are going to be eating up in room 430, 430, AB, sorry, 430 AB. And is this the direction you want folks to head in? All right, please head out that door. We'll have staff there to direct you. Thank you so much for a great morning. Looking forward to the rest of the day.